We all know, and if I haven't been clear about this, the number one problem for men on TRT is estrogen. Whether it's too high, or they take an aromatase inhibitor and they can't get the dose right, or they respond poorly to those drugs where they metabolize it very quickly, then the estrogen goes too low and then they have side effects. And it's like, people just have a difficult time dialing in estrogen on testosterone. But what if there was a strategy, my friend, that instead of dosing higher doses of testosterone, you could dose lower doses of testosterone so that the estrogen stayed in range, but then you could bring in one of the most powerful anabolic agents, a very strong oral steroid, to give you the confidence, masculinity, the anabolism, and the strength. And you could actually do so in a safe way. And then a low, safe, carefully monitored dose of Oxandrolone or Anavar per day. Can this be done safely? But most importantly, for those of you struggling with estrogen on TRT relative to sexual function, can it bring back your libido while also giving you massive strength in the gym? We start the video. Look, Cortex Labs is a performance optimization company that specializes in hormone protocols for men. We got a range of different products ranging from the Torque Stack. This is a nootropic that I built, basically Adderall without the side effects. It's 35% off right now. Get it down in the description of this video. Source list, a vetted compilation of trusted sources for all anabolics, including DHT, test of all esters, Anavar, anything you can think of. Get that down in the description of this video. And lastly, I'm a coach on TRT protocol restructuring. We've got a one-off consult with me or longer-term one-on-one packages targeted specifically for people with serious sexual dysfunction. And you can hire me for any one of these programs in under a minute at livecortex.com. And so look, the bottom line is, yes, the most common problem that I see with men on TRT is an inability to deal with estrogen. They take an AI, the estrogen goes too low, or they have joint pain or otherwise problems and it messes with their libido. The whole purpose is of reducing estradiol, aside from trying to reduce some of the side effects that some people get, mood side effects, acne, gynecomastia, things of this nature, is to revive and correct impaired sexual function so that you got raging boners, rocking erections, and raging libido. But some people just can't dial in. So we have this sort of pretty commonly repeated notion or strategy of lowering your TRT dose into oblivion so that the estrogen falls in that 20 to 30 range, maybe even 15 to 18 picograms per milliliter range. There's guys that need to be in that range, to where then all the sexual function is intact. However, at those lower doses, you lose a good degree of some of the benefits of TRT, namely the anabolism, the strength in the gym, the energy all day, the confidence, and the masculinity. So the question I want to pose is, could one remedy those former very positive, attractive things that come from the use of androgens while still keeping testosterone itself I wouldn't say low, but somewhat of a low TRT dose so that estrogen is in a beautiful place for sexual function? The answer is with low dose, intermittent, carefully monitored use of Anavar or Oxandrolone is yes. Oxandrolone or Anavar is a highly potent anabolic and less androgenic, but still androgenic oral steroid that most commonly is used for anabolism. And in many cases in low doses, just increases strength, muscle gain, muscle protein synthesis, the ability to lift more weights, and ultimately comes with a variety of very positive anecdotal reports around physique, increased vascularity, increased bulkiness, increased shoulder size, bolder shoulders. People start taking Anavar and suddenly they're lifting 25% more than they've ever been able to lift in a very short period of time. In this context, you have your cake and eat it too. You've got your TRT at a lower dose, call it 70 to 100 milligrams, so that estrogen's fine in the sexual system is great, but then you got some Anavar just a little bit on top of that, and then you're strong, you're bulky, you gain muscle mass, you've got confidence, you've got strength. Now, I know what you're thinking. Anavar may come with some health complications, a reduction in HDL, an increase in LDL. As a 17-alpha alkylated steroid, it is, I wouldn't say harsh on your liver, but it's not entirely benign. Studies show transient increases in liver enzymes in some degree of the individuals with the use of Oxandrolone or Anavar. In a study titled Effects of Oxandrolone or Anavar on Cardiometabolic Health in Boys with Klinefelter Syndrome, a randomized control trial, they make it actually very clear that although Oxandrolone has positive effects on measures of cardiometabolic health in pre-pubertal boys with Klinefelter syndrome, it does lower HDL cholesterol and advance bone age. They end up stating that total and HDL cholesterol were significantly lower in the oxandrolone group, whereas LDL cholesterol was not different between the age groups. Now, again, keep in mind, this is younger people. As you age, this might change, and the LDL may in fact go up. They do say in the safety profile section, though, of this study that overall oxandrolone was well tolerated and there were no serious adverse events attributable to the drug. No one withdrew for concerns over safety. What they ultimately found relative to HDL is that, yes, there was a decline in the percentage of the people that were using oxandrolone in HDL cholesterol. However, that decline sort of bottomed out at a certain point and then did not reduce any further. And there's the notion of, is it hepatotoxic, right? Because it's 17 alpha alkylated, it does pass through the liver and may cause a burden to the liver, let's say, for a temporary period of time. However, in this paper titled "The Effect of Oxandrolone on the Endocrinologic, Inflammatory, and Hypermetabolic Responses During the Acute Phase Post-Burn," they go on to say that a possible concern associated with oxandrolone administration is an increase in liver enzymes, a phenomenon that has been described also by other groups. During our study period, oxandrolone significantly increased AST and ALT, which occurred 2 to 3 weeks after oxandrolone treatment was started. But then they go on to say serum AST and ALT are normally considered markers for hepatic or liver damage, and therefore one may suggest that oxandrolone causes some degree of liver damage. However, we further showed that oxandrolone decreased hepatic acute phase protein concentration, whereas it increased constitutive hepatic protein concentration. This indicates an improved hepatic homeostasis and protein production by the liver. This finding was also shown by Thomas and colleagues, where they cited a link. We also show that liver size and weight was not significantly different between controls and oxandrolone patients, which indicates that oxandrolone did not cause hepatomegaly, that is, the increase in liver size. It furthermore appears that oxandrolone did not cause major hepatic damage. We measured serum IGF-1, IGF-BP3, and growth hormone, all of which are mainly synthesized in the liver, and found no significant difference between controls and oxandrolone treated patients. These data indicate that liver function maintains intact with the use of oxandrolone, but we suggest that the elevation of liver enzymes should be monitored during the treatment period with oxandrolone. Now, as biohackers, TRT protocol hackers, HRT plus protocol hackers, we have a lot of tools available to both monitor as well as to address situations like this. Relative to liver enzymes, we've got compounds like TUDCA and milk thistle, which we know do positive things for liver function. In the case of TUDCA, enhancing the synthesis of bile acids while also reducing cholesterol both in the serum as well as the liver. So TUDCA with some oxandrolone in your TRT protocol, definitely a must. Also, TUDCA inhibits cell apoptosis by disrupting the mitochondrial pathway of cell death. So it's very protective. And if you're concerned about the intermittent use of Anavar on top of TRT and the potential for elevation of liver enzymes, definitely take TUDCA with it. Relative to the HDL and the LDL concerns, we have a lot of compounds that can mitigate any degree of problem and fluctuations of those levels of cholesterol to reduce cardiovascular risk. But one of them that isn't talked about enough that I really like and started using to mitigate hair loss or to stop it from happening with the use of cycle levels of testosterone and obviously things like proviron and primobolan is Tocotrienols. Tocotrienols are a class of vitamin E compounds that are very cardioprotective and have a lot of positive benefits on male health. This is a paper that is titled "Tocotrienol is Cardioprotective Agent Against Aging-Associated Cardiovascular Disease and its Associated Morbidities." Again, I have been raving about tocotrienols for quite some time. There is literature to back that up. Tocotrienols are a must in your regimen regardless, but you want to take them if you're dosing oxandrolone to try to prevent some of these negative changes in HDL and LDL cholesterol. Relative to dyslipidemia, which is ultimately what we're talking about here, the study says tocotrienols can alleviate hyperlipidemia and hypercholesterolemia, huge risk factors in cardiovascular disease risks, through triglyceride and low-density lipoprotein cholesterol, which is LDL-C, reduction by up to 25%. Go on to say, work from our group previously showed the cardiovascular and metabolic health benefits of tocotrienol supplementation in tissue culture systems, rodent models, as well as in human studies. They then say in these studies, tocotrienols reduce the production and transport of triglycerides in cells, rodents, and humans, thereby reducing triglyceride levels by 28%. Tocotrienols not only lower LDL-C and triglycerides, but they are also anti-inflammatory and provide multiple points of health benefits to lower cardiovascular disease risk. Those interested, the mechanism for cholesterol reduction induced by tocotrienols in the context of the use of oxandrolone with TRT have been elucidated to a large degree. Tocotrienols can suppress the production of 3-hydroxy-3-methylglutaryl coenzyme A, or HMG coenzyme A reductase, which is the rate-limiting enzyme essential for cholesterol production. This is similar to the mechanism of statins. Actually, it is the mechanism of statins. So what's the major point? Take TUDCA and take tocotrienols and possibly some of your other ancillaries that aid in functional LDL and HDL so that those levels don't get out of whack and that your liver enzymes stay in a good place. All that said, just clearing up the safety stuff and strategies to comfortably take Anavar, let's talk about protocols. Now look, the doses on Anavar range. I mean, if you study the people using Anavar on the steroids subreddit, you've got people like this guy who says Anavar is likely the only oral I will continue for the rest of my life. I run it at 40 milligrams for 6 weeks and split the dosage AM and PM. So running 20 milligrams in the morning, 20 milligrams in the evening. Here's another one. These are high doses and not the doses that I would suggest. I'll get to that in just a second, but just to give you guys some context, 6 weeks, 25 milligrams in the morning, 25 milligrams in the evening. This guy jerked off so much vigorously that I gave myself friction burn. He goes, my sex drive was crazy. But then there's some people that say 10 milligrams, okay, 10 milligrams Anavar makes a world of difference. And some guys would say that's a bullshit dose, but it shrink wraps my skin. It makes my pumps ridiculous, even on what is ultimately a deficit 1,500 calories per day. So what have I found in coaching? What have I found in scouring all of the literature? And what have I found in scouring all of the anecdotals that might be a good Anavar dose on top of a low dose of TRT to, again, keep estrogen great and the sexual function great, but then maintain anabolism, strength, confidence, and masculinity? The answer to that question is anywhere from 5 to 15 milligrams per day. What I would suggest people do is start at somewhere between 10 and 15 milligrams a day. Dose that once per day, preferably before the gym. Go to the gym, you're going to be stronger, you're going to have insane pumps, you're going to be able to lift more weights in a relatively short period of time. We're talking about 2 to 3 days after the administration of Anavar, maybe even on day 2, you're going to sense that you're stronger and your physique is going to show it. With a low dose of Anavar of, again, between 5 and 15 milligrams a day, I mean, we couch it somewhere around 10 milligrams a day, for a total duration of 8 weeks with the proper use of tocotrienols as well as TUDCA, in addition to doing cardiovascular exercise, specifically jogging. If you can force yourself to do it, that's going to be way better cardio than any other cardio. In addition to, of course, with the use of anabolic androgenic steroids, making sure that your diet is not loaded with bad fats and otherwise shitty food like super high glycemic index carbs eaten in excess. In that context, with a healthy person that eats a healthy real foods diet that doesn't go overboard in extra sugar, high glycemic index carbs, or trans fats, and even high loads of saturated fats, an 8-week run of 10 milligrams a day of Anavar is probably not going to budge your bloods much at all. Or if it does, it may lower the HDL a little bit, increase the LDL a little bit. But again, if you're doing all of these other things, especially the use of tocotrienols, which function like statins, then you're probably going to be able to mitigate a good degree of those negatives. Same thing with TUDCA relative to liver enzymes. And in the end, you have your testosterone at, if it's cream, 2 pumps, 3 pumps a day, right? If it's prop, 15 to 20 milligrams a day. If it's cypionate or anything, 80 to 100 milligrams a week. You're not on super high doses, therefore the estrogen's just not going to go outside of the favorable range. Therefore, you're going to have rockin' erections and a pretty high libido. But then with the use of Anavar, you've got anabolism, strength, erections, and libido as well, because as a DHT derivative, it really does stroke the androgen receptors in the brain, I have found through a lot of clinical research. as well as anecdotal research. So you've got increased sexual function just with the use of Anavar. People typically report minimal hair loss, minimal to no hair loss. Okay, it's one of the safest or sort of hair safe DHT derivatives that we have because it is less androgenic and much more anabolic. And in the end, you get to have your cake and eat it too. This channel is all about giving strategies for people in somewhat murky situations. TRT is not always easy to manage. That is why I make a great living doing coaching and consulting on TRT, because I've seen it all and can help guys out of pickles relatively fast. And the number one thing that is problematic relative to management of TRT is estrogen. And usually too much estrogen or not being able to get estrogen in your range makes sexual function suffer on TRT. So if you can low dose testosterone and keep estrogen in your sweet spot range and still get the anabolism while safely dosing a very powerful oral anabolic while monitoring your bloods and executing the use of Tocotrienols and TUDCA and some other compounds that we talk about and that Vigorous Steve talks about relative to HDL, LDL, and liver enzymes, then you have a hack to the murky situation you are in that gives you a favorable outcome. That's what this channel is about. More to come on this. I'll be dosing some Oxandrolone up and coming. I have some that I haven't used at all. So I'm going to see specifically what it's like for me personally relative to anabolism coming off of a testosterone cycle and going back down to just above TRT doses of testosterone. So I'll keep you guys posted on that. But aside from this video, this isn't the first time that I have been talking about this because I have clients that are in this situation where we use a non-aromatizable androgen, not always Anavar, but non-aromatizable androgens and just a little bit of testosterone, and then they're dialed in. All right, look, if you need to hire me for coaching, we've got one-off consults. It's a TRT protocol restructuring. I mean, this is the bulk of our work where we'll fix your protocol, whether it's sexual function, otherwise side effects. Usually it's libido and erection issues. We'll get you dialed in relatively quickly. I'll write a protocol for you after hearing your situation. That is the one-off TRT protocol redesign consult. Secondarily, for serious sexual dysfunction, you want to hire me for 3 months, 6 months or more so that we can truly get to the bottom of it using and executing while carefully monitoring a vast degree of protocols involving not only the use of DHT, proviron, other DHT derivatives, but other compounds that we don't typically talk about to truly dial your sexual function in and resolve longstanding libido and erectile issues. Hire me for any of that stuff in under a minute at livecortex.com. Source list, again, guys, a compilation of trusted sources for anabolics. I take this stuff very seriously and do not want people going and seeking out anabolics from websites that they can't truly vet. I vetted all of them. I vetted the best ones and put them all in a list, and you can get that literally now as an instant download at livecortex.com, including all of the stuff you see, which also includes oral DHT and DHT gel. Torque Stack, if you want that Adderall-like feel, but not the Adderall-like side effects, just buy Torque. It is 35% off in the code, and the link is down in the description of this video. Okay, boys, happy Monday. I hope you had a great weekend. It's been an absolute pleasure hanging out with you. Please sub to the channel. Like the video, it makes a huge difference to the algorithm. We're just about to hit 30,000 subscribers, so please let's make that happen. If you're watching, hit the sub button. Otherwise, enjoy the rest of your week. More content coming soon, and I'll talk to you boys on the next one.